Hello there. My name is Marilyn from Maya Health Wellness. I'm a healthcare provider working in an outpatient clinic. In this channel, we look at some of the factors that promote well-being and, of course, look at some of the things that you go through as a healthcare provider. In my previous channel, we talk about malaria and some of the things that we discussed there are some of the complications for malaria, severe forms of malaria. Some of those presentation needs an emergency care. That one leads us to our today's topic, which we are going to look at triad. Some of the things that we want to look at, why triad? Okay, why do you need to do triad? Who is most likely to die rapidly if they are not attended with emergency? And of course, we want to look at how to categorize triad, because how do you prioritize who needs to be seen first and who can wait a little bit longer, or who can stay on the queue. So now, before we can start, for those who are joining us for the first time, as we always do, karibuni sana. For those who are our continuous subscribers, shukran. Don't forget to like, subscribe, hit the notification bell so that you don't miss out on any upcoming videos, and of course share, and let's learn together. So we want to look at triad. Okay, what is triad? Would you understand by the word triad? Or what? Should I leave that one on the comments so that you can tell me? Okay, tell me what you understand by the word triad on the comments below, and of course let us share. Let us have that discussion on a chat. We can do a chat and then we'll get to know what you understand by the word triad. So now, when you talk about triad, what is this that we need to look at then? So now, why do we need to do triad? Why do you think it's very important for us to do triad? Okay, anytime I think about triad, anytime I think of someone being sick, a child's rings into my belly, or the name of a child, it rings into my ear, and my heart breaks whenever I feel or hear that a child is sick. So one of my greatest pain is that some of children will die waiting to be seen by doctors. Some of them, if you go to this facility, you'll hear mothers crying of having lost a child while they're still waiting on the bench. And most of the time, this one goes for us health practitioners, because they blame us that we take long before attending to these patients, and then we ended up losing this particular child. I'm a mother myself. I will be so heartbroken if at all I lose a child when I'm still waiting for a doctor to attend to my little one. So it's something that breaks my heart. And of course, of all these children dying in hospital, 50% and above die within 24 hours. So what is this that is making these children die? Imagine losing more than 50% of children within 24 hours after being admitted in hospital. What is this that happens that we as a health practitioner could have done in order for us to prevent this death from occurring? Of course, some of these children can only be saved if treatments are started immediately. Because when a child is sick, they're being taken to health facility, they're being attended on time, and of course, we'll be in a better positions to prevent this death from occurring. So triad, when we talk about triad, we separate them into three categories, whereby one, we look at emergency care. Okay, we prioritize them on who needs an emergency care, who needs a priority care, and number three, non-urgent, or those who can wait on the queue. Okay, so that is how we separate when every patients are visiting health facility. So now we have to categorize them into three subgroups so that we get to know who needs to be attended first, who can wait on the queue, who is this that need priority care. So we've talked about three categories of patients who walk into a health facility, whereby one, we talk about emergency care, those who need emergency care. So those ones have to be put separately. Okay, there can even be 2, 1, or 10, but now all of them needs emergency care, so they have to be handled with emergency. And then we have number 2, those who need priority care. Okay. And then number 3, we have non-urgent, those who can wait on the queue. Okay. So now when you talk about emergency care, or those who need emergency care, number 1, we look at the airway. How is the airway of this particular individual? We look at breathing. When we think of breathing, or when you hear the word breathing, then what comes into your head is oxygen. Okay. Then we look at circulations. We look at consciousness of these particular individuals. Is it reduced, or are they unconscious completely? So we look at the consciousness of that particular individual. And then another thing that we also look at, we look at convulsions. We also look at dehydrations, whether it's severe dehydrations, or it's moderate dehydration, or it's some dehydration. So some of those things that we look at a triad. So those ones are some of the major things that you look at out in patients that needs emergency care. Now our second category was those who needs priority care. Okay. Now who is this that needs priority care? Now these ones depend on the assessment that we do on this particular patients. So now for those who need priority care, one, they're tiny. Okay, we talk about tiny, or any child less than 2 months old, tiny baby. Okay, less than 2 months old that needs a priority care. Number 2, we look at temperature. Any temperature or high temperature, that one needs priority care. Then we also have those with trauma. Okay, we also have pallor that is severe. Okay, those ones need priority care. We look at pain. Any child or any person with severe pain, that one person need priority care. And then we also have poisoning. When you talk about poisoning, a mother can tell you that this child consumed something, then that one needs a priority care. And then we have respiratory distress, we have restlessness. Okay, they're not able. The child wants to sleep, you want to cry, you want to change, you want to keep on changing position. They're restless. Okay, or they're irritable. If you touch them, they start crying. They don't want to touch them. They don't want to do anything. They're irritable. So those ones need priority care. Or when you look at a floppy baby, the baby is just there. Okay, if they're lying, it's just there. They're not moving. They're not doing anything. They don't have any interest in anything. So those ones need priority care. Then any child that has been preferred, especially if urgent, any referrals, this child was seen in a particular facility and then has been referred to this hospital, then of course this one needs a priority. They need a priority care. Then we also have malnutrition, we have edema and burns. Any individual in all those categories that I've listed needs priority care. And then now remember we talk about how while doing triaging, how we categorize patients whenever they work in health facility. So number 1, we talk about emergency care. Those who need emergency care have been asked to be put separately. And then of course we have number 2, those who need priority care also has to be put in a different category. And lastly, we have those who needs those with non-urgent cases that needs not to be attended with emergency. Of course, we'll have to attend to them, but they can queue and wait patiently for the time. So they are also put on different category. So now, who can do triad? Okay, anybody can do triad. It can be doctors, it can be clinical officers, it can be nurses, it can be cleaners, it can be askaris, health record clerks, absolutely anyone. Sometimes even patients help us to prioritize others. If they look like, no, this baby or this person needs emergency care, they're not feeling so well. So anybody, absolutely anybody can do triad. So there are some simple steps that can be done in order for us to prevent deaths from occurring, or in order for us to assist us to get to know how urgently these patients need triad. So now there are some of the emergency signs. Okay, there's some of the emergency signs that patients present with. So now one of these signs, some of the things that very simple step that we need to use in order to evaluate and get to know who needs emergency care, who needs priority, and with those ones non-urgent cases that can queue and wait on the line. So one of the signs that we need to use, we have ABC. Okay, we have we have ABC, a very simple tool that we can work on in order for us to be able to identify who needs to be attended first and who can wait a little bit longer. So now, those emergency signs, if history of trauma, if there's any history of trauma, then as an individual, ensure that the cervical spine is protected. At any cost, ensure that cervical collar is protected. If the need be for you not to touch that particular patient, even the better, because you don't want you to cause more trauma. In the essence of you wanting to help this particular patient, then you end up causing more trauma. So ensure that the neck spine is protected. And then once that has been done, there are those three things that we look at. A very simple tool, we look at ABC. So now when we talk about ABC, we talk about airway, we talk about breathing, we talk about circulation. So S stands for airway, B stands for breathing, and lastly C stands for circulation. So under airway and airway and breathing, we look at obstructed airway. Is there anything that is obstructing the airway? If at all there's something that is obstructing the airway, then remove that thing. Then look at central cyanosis, severe respiratory distress, some of those things that we look at. And those we look at weak or absent breathing. Okay, so anybody who has that presentation, then immediately transfer to the emergency area. Anybody who has those classic presentations should be transferred to emergency area. Then we look at, when we look at circulations, okay, once they have been transferred to the emergencies area, then they will be started on a life support. Okay, then life support procedures, then oxygen will be initiated, and of course weight can also be they can be weighed if possible. So now when you look under circulation, you look at the cold hands. When the hands are very cold, okay, and you look at capillary refill, how long did it take for capillary to refill when you put pressure. And then we look at the weak or fast pulse, and I think that we look at is slow. Okay, when the patient has slow or absent pulse, the pulse are very slow. If you try to check at the pulse, it's very slow, or of course it can also be absent. And then we also have patients who are coma or convulsions. So or even those ones who have confusion. So when you look at AVPU, either one, they are at P, which they only respond to pain. So if at all you inflict pain on them, then they'll respond to pain, or they are non-responsive. So those who are non-responsive, again, immediately refer them to emergencies area where life support procedures has to be initiated, or they can also be given oxygen, and then the doctors can pick it from there. Another category when you're also looking for those emergency signs is diarrhea with sunken eyes. Any child with diarrhea, you have sunken eyes. Also we have fontanelle, bulging, or is it bulging or sunken fontanelle? Sunken fontanelle, of course. So we have sunken eyes and fontanelle also. So those ones again, assess, okay, and treatment for severe dehydration has to be initiated immediately, because one of the most fear is losing those child due to dehydration. And then of course, once you have looked at those ones, immediately action taken. Once you have assessed and get to know that these are some of the people who have who are non-responsive or presented with convulsions, some of these are airways are obstructed, they can't breathe when they have absent or slow pulse, then those ones are immediately immediate action taken. Okay, and then they can also be referred to emergencies areas where they can be attended. So those are some of the emergency signs for those ones who need emergency care. Remember that we talk about 3 categories, so we are in our second category, which is priority care. For those individuals that we have categorized them into priority. Okay, so number one of those we say tiny baby. Okay, sick infant age less than, of course, less than 2 months. Another thing that you also look at, temperature. Very high temperature above 39.5 degrees Celsius. We look at trauma, major traumas. Okay, there was a trauma that the child was involved, then that one is a priority care. Then we also have pain. Any child in severe pain, okay, those one has to be attended with emergency. And then we also have poisoning. Mother reports of a child consuming poison or something. Then that one has to go under priority care. And then we also have pallor, severe pallor or palm of the hands. Those ones again needs to be categorized. So some of those are the signs that you see. Of course, we have restless or irritable. We also have respiratory distress. Referrals, okay, has an urgent referral letter. Any baby with an urgent referral letters, those ones has to be given priority care. And then of course lastly we have malnutrition, we have edema, and then of course we have burns. Any child with burn, any child with edema, any child with we talk about edema, we talk about swelling, yeah, any swelling of the body, okay. Then we can talk about generalized edema, or we can talk about localized edema. So those ones need priority care. So those are some of the signs that you need to know. A good example is when we talk about ABC. Remember, very simple tool for us to get to evaluate and get to know who needs priority care, who needs emergency care, and who is non-urgent, who is this that can just sit on the queue and wait for their turn. So now one of those A's, we talk about airway. No noisy breathing, no noisy breathing, okay. And then B, no cyanosis or severe respiratory distress. And C, we talk about cold hands, okay. So when we hear A, some of the things that you can hear, tumesema here, okay, airway, you can hear, you can feel, okay. So no noisy breathing, that's an alert. No cyanosis or severe respiratory distress, cold hands, capillary refill of less than 4 seconds, or pulse that are very fast, okay. So those are the things that of course we need to look at. So now, what is our summary on all this? So triad is sorting only. What we do in triad, we're trying to sort out who needs to go where, who can wait, who can be attended to fast, who can wait a little bit longer, and who can sit on the queue and wait, okay. Diagnosis or treatment are not the responsibility of the person doing triad. Let's not forget about that, okay. That diagnosis, treatment, and everything that needs to be done, it's not the responsibility of person doing triad, of course. And then of course, in a very busy department, it is a continuous process. Yeah? It's a continuous and frequent process. So as patients keeps on working in, and then they keep on doing triad in order to keep on sorting out who needs to be on emergency, who needs to be on emergency care, who needs to go on priority care, and of course who can urgently wait for their time on queue and they don't need emergency. Of course, patients can change their condition while they're still waiting. Perhaps this patient was put on a priority care, and while they're still waiting to be attended to, they change conditions to emergency care. And that is why I'm saying that sorting out, it's a continuous, triad is a continuous process that these patients keep on, they keep on being checked so that they can be seen whether one, have they changed their condition, have they moved from priority to, of course, emergency care, or how are they doing, or is there any other new patient that walks in that of course needs to be attended urgently. A patient can walk in and you are on priority care, who needs priority care, and you needed to wait for a little bit longer, and of course somebody else walks in. It's just by virtue that we are all human. We just say that these ones need to be attended first, and it shouldn't be something that people need to argue about or people need to fight about. You know, sometimes patients, they're ready to fight that. No, you just came in here, been waiting for more than 5 hours, and you can't just walk in. But you can see that this patient needs emergency care. It's not like a rocket science that somebody needs to tell you this. So we all need to be calm, we all need to be patient to wait for our turn. But of course, if you're seeing as patients that as a healthcare providers are not doing that work of prioritizing who needs emergency care, then of course there is a good language that you can use in order for us to help these patients, because our main focus, our main aim where we are in this field is for us to offer the service to the humanity, to help improve and of course prolong life, save life and prolong life. So now that you've talked about triad, sorting out the patients who needs emergency care, some of the signs that you need to look at when you are doing triad. Now, from all those, you have not heard me talking about those people who are driving big machines. You kuingilia tu kidogo. We have not talked about those people who, as they always say, those people from the lakeside, yeah, those with big machines. You're coming with your big machine, you just park it outside there, and you're rolling your key for the Mercedes Benz, and then you're telling those people who are doing triad, do you know me? Yeah, you have not heard me mentioning people who are carrying big machines. We are not talking about titles that you're holding when you're coming to health facility. So now, if you are not falling under any category of emergency, people who need emergency care, or those people who need priority care, then you're not going to attend to you first. If at all your conditions allow you to sit on the queue, it's not urgent, then sit on the queue, wait for your turn patiently so that you can be attended to by doctor. But of course, if you have a patient who qualifies for among those two first categories of emergency and priority care, and of course you're going to attend to you. But you come in and tell us that do you know who you are, and of course you want us to attend to you first just because of your titles and then the big machines that you're rolling with. That way, those ones we are not going to tolerate those ones. Tutakuangalia tu na hizo mashini zako, and then we first prioritize those patients who need emergency and of course priority care. Then the rest, you can wait patiently with the queue. Until next time, thank you so much for tuning in. Don't forget to leave me a comment. Tell me about your experience when you are at the health facility. How were you handled? Did you love how you attended to? Did you waited for long? Did you see somebody who really needed emergency care and they were not attended to on time? Help us improve the services that we provide to you, and above all, let us care about our brothers and sisters. Okay? Until next time, remember that next time we're going to discuss about dehydration in children. Remember that we mentioned a little bit of dehydration, what you need to do, assessment for dehydration there, and of course starting treatment. So my next topic is dehydration in children. Until next time, bye.